Our facial expressions are visible signs of how we feel. A furrowed forehead or brow may make you seem angry. A low or sagging brow may cause you to appear sad or tired, even when you're not. Unfortunately for some people, wrinkles, facial creases, and loss of firmness in the upper face can become permanent, either as a result of overactive muscles in the forehead and brow region, heredity, or the aging process. A brow lift can restore a more relaxed and youthful appearance to the forehead and brow. Through brow lift surgery, creases that develop across the forehead can be smoothed. Frown lines between the eyebrows can also be improved. In addition, a brow lift can improve moderate hooding and a heavy appearance in the upper eyelids caused by sagging brows. By raising the position of the eyebrows, the upper eyelids appear more opened, resulting in a youthful and alert appearance. This program presents an overview of brow lift surgery. It is not a substitute for a complete consultation with a plastic surgeon certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. A brow lift is best performed on healthy adult men and women. Good candidates for brow lift are individuals who do not have life-threatening illnesses or medical conditions that can impair healing. A positive outlook with specific and realistic goals for improvement of their appearance is a must. If you smoke, you are at increased risk of poor healing, including the formation of irregular scars, and therefore it is advisable to stop smoking for several weeks before and after surgery. A consultation with a board-certified plastic surgeon, a member of the American Society of Plastic Surgeons, who may also be a member of the American Society for Aesthetic Plastic Surgery, is the first step to learn how a brow lift can enhance your appearance and improve your self-image. A consultation is designed to fully educate you regarding brow lift surgery and consists of a discussion of your goals, the options available, the likely outcomes, and potential risks or complications. Your surgeon will also describe the procedure and answer your questions. During a consultation, you will be asked to share your expectations for surgery and your personal health history. Full disclosure of your health history is important for your safety. You should inform your physician of any life-threatening illness or medical conditions in your family. You must also be candid about your current medications, vitamins, herbal supplements, alcohol, tobacco, and drug use. By making the decision to consult with a board-certified plastic surgeon and following physician recommendations, you are taking an important step in helping to ensure your safety. A board-certified plastic surgeon is a physician who is specifically trained in plastic surgery of the face and entire body. Prior to your procedure, you will be asked to sign informed consent documents. These documents assure that you fully understand the procedure you will undergo, the potential risks and complications. In addition, you must commit to precisely following all of the instructions you are given. Instructions include pre-surgical considerations, such as testing and medications, day of surgery requirements, medications, and specific information related to the use of anesthesia. Prior to surgery, it is important to discuss all of your questions and convey any concerns you may have regarding surgery to your physician. A brow lift may be performed in an accredited office-based surgical facility, an ambulatory surgical facility, or a hospital under local anesthesia with sedation or general anesthesia. The decision for anesthesia will be based on the requirements of your specific procedure. Any additional procedures that may be performed in the same surgical session as your brow lift, and considerations of patient and surgeon preference. A brow lift is often performed in conjunction with other rejuvenative surgical procedures, such as eyelid surgery to restore a more youthful appearance and firmness to the upper and lower eyelids, and a facelift to improve the signs of aging in the mid-face, jowls, and neck. The results of a brow lift may be enhanced through laser resurfacing or a chemical peel to further improve skin tone and texture. In addition, botulinum injections, such as Botox, may be recommended prior to a brow lift to help underlying muscles fully relax before repositioning or tightening. Injections may also be suggested following the procedure to help maintain your results. Your plastic surgeon will recommend the brow lift technique or a combination of techniques that can best achieve your goals. The decision will be based on your anatomy, the position of your hairline, your appearance, and the degree of improvement necessary to realistically achieve your goals. If you have thinning hair or are bald, you may still benefit from a brow lift. A brow lift can be performed using limited incision techniques with the assistance of an endoscope, a surgical video device, and special instruments. Several short incisions are placed within the hairline at locations determined by your plastic surgeon. Through these incisions, the muscles that create expression lines and the resulting furrows and creases are removed or weakened. In addition, a low brow may be repositioned and secured by the use of permanent sutures, small surgical screws, or an absorbable fixation device placed inconspicuously at the temples. Your plastic surgeon may recommend an incision within the natural contour of the upper eyelid to address furrows between the brows. An alternative brow lift technique uses a coronal incision, one that extends across the crown of the head within the hair. A coronal incision allows your plastic surgeon to address the underlying muscles of the brow and forehead region and to reduce any excess skin that contributes to a low or sagging brow. When your brow lift is completed, incisions are closed with removable sutures, skin adhesives, surgical tape, or special clips. Laser resurfacing or a chemical peel can further soften the appearance of wrinkles and creases in the brow region and improve skin texture. Your head may be loosely wrapped to minimize swelling and bruising. Before being released, you and an accompanying family member, friend, or caregiver will be given specific instructions that may include how to care for your incisions following surgery, medications to apply or take orally to aid healing and reduce the risk of infection, specific changes to watch for at the surgical site or in overall health, and when to follow up with your plastic surgeon. Initial healing may include swelling, numbness, and discomfort that can be controlled with medication. As the incisions heal, they may become somewhat itchy. In addition, some facial movement may be temporarily impaired. These are common conditions. In general, possible complications associated with a brow lift include areas of temporary hair loss or numbness within the scalp. In addition, poor healing of scars, bleeding beneath the skin, hematoma are possible. Facial paralysis is extremely rare, but possible. An elevated hairline is also possible. In addition, there are risks related to the use of anesthesia. These and other potential complications will be carefully described to you prior to your procedure. Your physician will instruct you to keep your head elevated at all times until initial swelling subsides. You will be provided specific post-operative instructions, including cleansing of your face and hair. Following instructions is essential to the success of your outcome. Your naturally alert appearance and smoother, more youthful brow will be visible soon after surgery. A return to light, normal activity is usually possible within a few days of surgery. After 5 to 10 days, swelling will diminish rapidly, and any sutures or clips will be removed if necessary. You will be ready to return to work and regular activity at this time. Cosmetics can camouflage any bruising or redness that may remain. Healing will continue for several weeks as swelling resolves completely and incision lines continue to improve. Diligent sun protection is recommended until the healing process is fully complete. This is imperative if you have had any resurfacing techniques in conjunction with your brow lift. Continue to follow physician instructions and attend follow-up visits as scheduled. The results of your brow lift will refine gradually over time. It may take a year for incision lines to fully improve. Your brow lift should reveal a naturally more youthful and alert appearance that reflects your positive and energetic outlook. These results are long-lasting, but not permanent. You will continue to age naturally over time. However, most patients find that the benefits of their brow lift remain for many years. Choosing to undergo a brow lift or any plastic surgery procedure, whether cosmetic or reconstructive, is an important decision. So is selecting a plastic surgeon. Not all doctors who perform plastic surgery or who use the title of plastic surgeon are board certified in plastic surgery. In order to be certified by the American Board of Plastic Surgery, a physician must graduate from an accredited medical school and then complete a minimum of 5 years of surgical training, including an accredited plastic surgery residency program. The physician must pass a comprehensive written and oral exam in order to become a board-certified plastic surgeon. The American Society of Plastic Surgeons and the American Society for Aesthetic Plastic Surgery have prepared this educational program to supplement your personal consultation with a plastic surgeon who is certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Plastic surgeons with this certification have completed approved surgical training and rigorous examinations in plastic surgery, including both cosmetic and reconstructive procedures of the face and entire body.